Hello everyone, welcome to my channel again. I am Chioma Liu and I'm back again with a special topic. Today we are going to be discussing about a health issue. We usually say it is common or it's ordinary, and that is malaria. In this video, we are going to be learning about what malaria is, the causes of malaria, how you can diagnose malaria, how you can prevent it, and so on and so forth. Now, malaria is a potentially life-threatening disease caused by Plasmodium parasites. These parasites are transmitted into a person through the bite of an infected female Anopheles mosquito. So that is the way malaria is being transmitted. The malaria is caused by Plasmodium parasites, and these parasites are usually in the body of this infected female Anopheles mosquito. So once this female Anopheles mosquito bites a person who is healthy, the person gets this parasites. Once the parasites enter into the human body, it will go straight to the liver, cause a lot of harms to the liver cells. It can even, if left untreated, can go to the red blood cells and destroy the red blood cells. So these are the reasons some people come down with low packed cell volumes or blood level because of a malaria that has been left untreated for a long time. Now, there are symptoms of malaria. Some of the symptoms are fever, chills, sweats, headaches, nausea and vomiting, fatigue, muscle cramps. These are some of the symptoms a person with malaria infection may come down with. Now, there are some diagnostic measures or how you can find out if you have malaria or not. And the major one is through blood tests, blood smears. They check your blood and see if you have any parasite of any Plasmodium parasites in your blood that can be suggestive of malaria infection. For the treatment, there are several anti-malaria drugs with different names and brands, different groups, depending on the Plasmodium parasite that is responsible for your malaria infection. So the best thing to do is not just concluding through the symptoms I just listed earlier. Maybe you start feeling those symptoms, you just conclude it's malaria. No, it is wrong. You don't self-medicate. So you need to go to the hospital and the doctor will ask you to run some tests, maybe malaria tests, malaria parasite tests. Then you check your blood if you have any parasite in your body. So once they find out which of the parasites you have, the doctor will give you prescription based on that. So please avoid self-medication when it comes to your health. Now, the major aspect of this malaria is prevention, because sometimes treating malaria can be so expensive, especially in areas where where economic growth is retarded. You understand? Like this, our country, Nigeria, it is very difficult. Like this period, so many people are struggling to get health care for themselves and for their families. So the best thing to do is to prevent these illnesses so we don't come down with problems. Now, the main area of these preventive measures is vector control. Vector control, that is controlling the mosquitoes. Now, maybe by using insecticide-treated mosquito nets, and also spraying your house with insecticide. Then also you also need to manage the environment to reduce breeding sites of this mosquito. Then another thing is chemo prevention treatment, which is given to vulnerable individuals who are living in the endemic regions, like the pregnant women or the infants. So, and another thing is personal protection. Like maybe during in the night, majorly, no mosquito is usually on rampage at night. So we advise you to wear long sleeves and also trousers. You can also use mosquito repellents for yourself to prevent the bite of these mosquitoes, because you don't know which one is infected with the malaria parasite. So you need to protect yourself at all costs. Now, impact of malaria. Malaria has caused a lot of damages, global burden. It has been a global burden for so long, and it is very terrible. It has also caused a lot of morbidities and mortalities, and even economic impact. Like I said earlier, some people, they don't even have the money enough to cater for their health care bills, and it is a very big challenge to the world. So instead of us to be looking for money to treat malaria, why not prevent this disease? Let's prevent it by taking care of our environment, by using insecticide treated mosquito nets, by taking care of our personal health, using long sleeves at night, especially in areas where there are so many mosquitoes. By doing this, we'll be able to reduce the occurrence of malaria and also prevent future damages. So this is where I'm going to be stopping today. And I believe you are able to understand what malaria is all about and why it is important that we get it treated. Thank you so much. Till we meet again. Bye bye.